Ovarian cysts are fluid-filled sacs that develop on or inside a woman's ovaries. While the word cyst can sound alarming, ovarian cysts are actually quite common, especially during a woman's reproductive years. Many women will have an ovarian cyst at some point in their lives, often without even realizing it. Understanding what causes ovarian cysts, the kinds of symptoms they may bring, and the available treatment options, including natural approaches, can help women make informed decisions about their health. To begin, it's important to understand what an ovary is and what role it plays in the body. The ovaries are two small, almond-shaped organs located on either side of the uterus. They produce eggs as well as hormones like estrogen and progesterone. Each month, in a normal menstrual cycle, an egg matures inside a tiny sac called a follicle. When the egg is released during ovulation, the follicle breaks open. Sometimes, however, the follicle doesn't release the egg or doesn't dissolve after the egg is released, leading to the formation of a cyst. There are several types of ovarian cysts. The most common are functional cysts, which include follicular cysts and corpus luteum cysts. Follicular cysts occur when the follicle doesn't rupture and release the egg, but instead continues to grow. Corpus luteum cysts form after the follicle releases its egg and then seals off and fills with fluid. These functional cysts are usually harmless and tend to resolve on their own within a few menstrual cycles. Other types of ovarian cysts include dermoid cysts, which can contain tissue such as hair or skin. Cystadenomas, which develop from ovarian tissue and can be filled with watery or mucus material. And endometriomas, which are associated with endometriosis and contain old blood. These types of cysts are less common and may require different approaches for diagnosis and management. The causes of ovarian cysts can vary. The most frequent cause is the natural function of the ovaries during the menstrual cycle. Hormonal imbalances, particularly those related to the use of fertility drugs, can increase the likelihood of developing cysts. Women with polycystic ovary syndrome, or PCOS, tend to develop multiple small cysts on their ovaries and may experience symptoms such as irregular periods, excessive hair growth, and difficulty with fertility. Severe pelvic infections can also lead to cysts if the infection spreads to the ovaries. Rarely, ovarian cysts may be associated with underlying health conditions or even ovarian cancer, especially in postmenopausal women. Symptoms of ovarian cysts can range from non-existent to quite noticeable. Most cysts cause no symptoms and are discovered during routine pelvic exams or imaging studies. When symptoms do occur, they may include pelvic pain, especially during menstruation or intercourse, bloating, a feeling of fullness or heaviness in the abdomen, and sometimes changes in menstrual patterns. Large cysts, or those that rupture, can cause sudden, severe pain, and in rare cases, cysts can twist the ovary, cutting off its blood supply, which is a medical emergency. Diagnosing ovarian cysts usually involves a combination of pelvic examination, ultrasound imaging, and sometimes blood tests to assess hormone levels or rule out malignancy. Most cysts, particularly functional ones, resolve without intervention. However, the size, appearance, and persistence of the cyst, as well as the woman's age and symptoms, guide the decision on whether further treatment is needed. When it comes to treating ovarian cysts, the approach depends on several factors, including the type and size of the cyst, the woman's age, her symptoms, and whether she is premenopausal or postmenopausal. For most women with small, simple cysts and minimal symptoms, a watch-and-wait approach is recommended. The doctor may monitor the cyst with periodic ultrasounds to ensure it is shrinking and not causing complications. If the cyst is large, persistent, or causing significant pain, medical treatment may be necessary. Birth control pills may be prescribed to regulate the menstrual cycle and prevent the formation of new cysts, though they do not shrink existing ones. In some cases, surgery may be required, especially if the cyst is large, appears suspicious for cancer, or has caused complications such as ovarian torsion or rupture. Surgical options include laparoscopic surgery for smaller cysts or laparotomy for larger or potentially cancerous cysts. Alongside medical treatments, many women are interested in natural or home-based remedies to prevent or manage ovarian cysts. While it's important to note that not all cysts can be prevented or treated naturally, especially those requiring urgent medical attention, some lifestyle and dietary strategies may help support ovarian health and reduce the risk of cyst formation. Maintaining a healthy weight, for example, can help regulate hormone levels and reduce the risk of cysts, particularly in women with PCOS. Regular physical activity supports overall hormonal balance and can reduce inflammation in the body. A diet rich in whole foods, such as fruits, vegetables, whole grains, lean proteins, and healthy fats, provides nutrients that support reproductive health. Limiting processed foods, sugar, and refined carbohydrates can help stabilize blood sugar levels and may reduce the risk of cyst development in some women. Certain herbal remedies are sometimes used to support ovarian health, though scientific evidence is limited. Chasteberry, also known as Vitex agnus castus, has been studied for its effects on menstrual cycle regulation and may help balance hormones. Evening primrose oil, flaxseed, and maca root are other supplements sometimes mentioned in connection with hormone balance. However, it's important for women to consult with a healthcare provider before using any herbal or dietary supplements, as some can interact with medications or have unwanted side effects. Stress management also plays a key role in hormonal health. Chronic stress can disrupt the delicate balance of hormones that regulate the menstrual cycle, potentially contributing to cyst formation. Mind-body practices such as yoga, meditation, deep breathing exercises, and adequate sleep can help lower stress levels and support overall well-being. Applying a warm compress or heating pad to the lower abdomen may help relieve mild pelvic pain associated with ovarian cysts. Over-the-counter pain relievers such as ibuprofen or acetaminophen can also be used for temporary relief. However, any sudden, severe, or worsening pain should be evaluated by a healthcare professional right away to rule out serious complications. For women with PCOS or frequent ovarian cysts, working with a healthcare provider to develop a personalized plan is essential. This may involve managing underlying conditions such as insulin resistance, using medications to regulate hormones, and making lifestyle changes to support reproductive health. While there are many natural and lifestyle strategies that can support ovarian health, it's crucial to recognize when medical intervention is necessary. Cysts that are persistent, large, or causing severe symptoms should be evaluated by a gynecologist. Additionally, women who are postmenopausal and develop ovarian cysts require careful monitoring, as the risk of ovarian cancer increases with age. Prevention of ovarian cysts is not always possible, but regular gynecological checkups can help detect cysts early and monitor any that do develop. Women should also be familiar with the symptoms of ovarian cysts and seek medical attention if they experience severe abdominal pain, bloating that doesn't go away, unexplained weight loss, or changes in their menstrual cycle. In summary, ovarian cysts are a common occurrence in women of reproductive age and often resolve on their own without treatment. The most common causes are related to the normal function of the ovaries, though hormonal imbalances, PCOS, and other conditions can also contribute. Treatment options range from watchful waiting and lifestyle changes to medication and, in some cases, surgery. While certain natural approaches, such as a healthy diet, regular exercise, stress management, and select herbal remedies, may support ovarian health, it is important to consult a healthcare professional for an accurate diagnosis and appropriate management, especially if symptoms are severe or persistent. By staying informed and proactive about their reproductive health, women can better navigate the challenges of ovarian cysts and maintain overall well-being.